Mike Gibson, Andy Kaplan here, and we're talking about the Guardian device, a device that I studied now for 20 years. It's a device that you implant. It monitors the intracardiac EKG and alarms you if your STs have changed. It buzzes and sends a signal to an external device with the idea that we're going to get people to the hospital quicker and improve outcomes. FDA approved. I'm talking today to Andy Kaplan, who's now using the device out there in clinical practice. Andy, how are you using the device and what are you finding?
We've been screening our patients who have suffered acute coronary syndrome events in the hospital and who either come into our surgery center or the cath lab at the hospital. Most of these patients have had prior events. Many of them have had repetitive stent experiences and become very concerned about the possibility of coronary disease. The usual treatment pattern for these patients has been repetitive screenings with stress tests at various intervals, but sometimes the stress tests don't pick up on symptoms. Sometimes the patients get lost track of and don't get them. And oftentimes they end up developing symptoms that they go to the emergency room and get negative workups for and are very frustrated by the fact that they spend hours and they spend money and they feel like something's going on and they just don't know. So the Guardian has been very helpful in terms of teasing out when these patients are experiencing short-term ischemic events, which are not able to be picked up on oftentimes clinically by the time they come to the hospital. And it's important to remember that if they don't have a prolonged event, they may not have any myocardial necrosis. And so by getting them there to the hospital earlier and being able to see these wonderful, very clear signals indicating actual ischemia, we're able to pick up on those patients. And our practices have had multiple saves by getting patients into the hospital earlier when they are having an acute coronary event, as well as picking up on those who had short-term ischemia that wasn't detected, but subsequently was revealed at cardiac catheterization.
You know, we've done a lot of great work over the past few decades getting people to the cath lab quickly. That's great. But we really fell down in terms of getting them to the hospital quickly. So, Andy, can you share some success stories where people got there quickly after the alarm went off, faster than the usual 2.5 hours?
Sure. We have had multiple patients that we've been able to educate and train so that as soon as that alarm goes off, they are getting themselves to the hospital, oftentimes activating the EMS system. And we've had them there within 20, 30 minutes and getting picked up on with their myocardial infarctions and getting right into the cath lab. I've had some that have been in the lab 60 minutes of onset of the alarm.
Wow. See, that's so much better than the usual 2.5 hours of symptoms before they call 911. You know, the other thing about this is the quicker you get someone into the hospital and into the lab, the greater the odds you can actually abort the MI and get that artery open quickly. The game is over after 4 hours of symptom onset. So 2.5 hours plus 90 minutes of getting someone to the cath lab, that's 4 hours. So getting people there in the time you're talking about has the potential to really not just have a save, as you said, but also reduce the risk of heart failure and reducing the number of walking wounded.
Right. I think some of the interesting information that has come out from the alerts trial that we both had the honor of participating in was the preservation of myocardium as revealed in the maintenance of normal ejection fractions in the group that had the alarms on. And I think that's what we're also seeing clinically in real world practice, is that by getting the patients in and getting those arteries open and reperfusing them, that we are saving that muscle so that they don't end up progressing to heart failure.
Well, to all the young people out there, I first got the call from a crazy inventor guy about this idea in 2001. We began our work then. Almost 25 years of work on this concept to get people there quicker. It's finally, I think, coming to fruition. Andy, thank you for all the hard work you're doing, getting those people to the lab quickly. Thanks for joining us today, and thanks for sharing.
It's been my pleasure, Mike. Thank you.